Hello, my name is David, and today I will discuss the human response to chronic obstructive pulmonary disease, COPD. We will cover the physiologic, pathophysiologic, experiential, and behavioral responses, along with nursing interventions for a 64-year-old female with COPD. Here is a 64-year-old female with a history of COPD, hypertension, and type 2 diabetes. She presents with shortness of breath, productive cough, and hemoptysis. Her arterial blood gases results indicate respiratory acidosis and hypoxemia, signaling worsening pulmonary function. These symptoms highlight the need for both clinical attention and addressing COPD's physiological and psychological impacts. The body activates several compensatory mechanisms to maintain homeostasis when experiencing hypoxia. First, the sympathetic nervous system SNS is activated, releasing catecholamines like adrenaline, which increases heart rate and causes vasoconstriction. This process helps direct more blood to vital organs, improving oxygen delivery. Next, the hypothalamic pituitary adrenal axis is triggered, releasing cortisol, which helps regulate inflammation, metabolism, and energy, supporting the body during stress. To further support oxygenation, the respiratory rate increases, which improves ventilation and enhances gas exchange in the lungs. Finally, in the response to acid-base imbalances caused by increased carbon dioxide, the kidneys retain bicarbonate to buffer acid and restore balance. These combined responses help the body manage stress and maintain a stable internal environment during hypoxia. Chronic inflammation in COPD leads to airway narrowing and oxidative stress, damaging lung tissue and elastic fibers and making it harder to expel air. Increased mucus production further obstructs airflow. In some cases, alpha-1 antitrypsin deficiency accelerates lung destruction. Chronic SNS activation raises heart rate and blood pressure, increasing cardiovascular strain. Prolonged cortisol release contributes to muscle wasting and frailty. Fluid retention worsens edema and shortness of breath, while airway damage leads to persistent hypoxia and hypercapnia, which strains the cardiovascular system. Over time, these responses become maladaptive, accelerating disease progression. There are two types of nursing interventions used for this case study. One is pursed lip breathing, and the second is Qigong therapy. Pursed lip breathing helps manage airway obstruction and improve ventilation in COPD patients. This technique promotes controlled breathing by guiding patients to inhale through the nose and exhale slowly through pursed lips, preventing air trapping and improving oxygenation. It also reduces SNS activation, decreases heart rate and blood pressure, and helps manage pulmonary hypertension. To measure this outcome, we would monitor the oxygen saturation with pulse oximetry, and we would track changes in respiratory rate and assess the arterial blood gases. Qigong combines deep diaphragmatic breathing, gentle movements, and meditation to improve lung ventilation, alleviate breathlessness, and enhance gas exchange. It reduces oxidative stress and systemic inflammation and promotes autonomic regulation, reducing sympathetic activation and enhancing the parasympathetic activity to help manage stress and anxiety. To monitor or to measure this outcome, we would monitor oxygen saturation and heart rate variability for autonomic balance and relaxation. We would also track inflammatory biomarkers like C-reactive proteins, CRP, to assess the reduction in inflammation. The physiological changes in COPD significantly impact emotional and behavioral responses. For example, activation of the SNS to increase heart rate and vasoconstriction may cause anxiety and fear due to breathlessness, leading patients to avoid activities for fear of worsening symptoms. Chronic cortisol release can result in muscle wasting and fatigue, contributing to helplessness and depression, which may reduce engagement in daily activities and lead to social withdrawal. Chronic inflammation and airway remodeling worsen airflow, heightening feelings of hopelessness, anxiety, and isolation. Impaired gas exchange causes hypoxia and hypercapnia, leading to cognitive changes, irritability, and fatigue. These contribute to mood swings and difficulty maintaining relationships. Fluid retention worsens edema and shortness of breath, increasing frustration and social isolation. These changes affect both emotional well-being and behavior, highlighting the need for interventions that address both physical and emotional needs in COPD care. Nursing interventions like emotional support and Qigong therapy are key in reducing the behavioral and experiential responses to stress in COPD patients. Emotional support alleviates anxiety, fear, and helplessness, improving mental well-being, increased engagement, and reduced isolation. Effectiveness can be measured using tools like the Generalized Anxiety Disorder Scale, the GAD-7, and patient-reported engagement levels. Qigong therapy promotes relaxation, improves breathing control, and enhances muscle strength, reducing shortness of breath and fatigue. It helps ease physical discomfort and reduces anxiety. The COPD assessment test, the CAT, can track improvements in symptoms, quality of life, and overall health, including physical and emotional well-being. Addressing these responses also improves physiological outcomes, reducing anxiety, fear, and stress-induced behaviors and experiences, lowers the sympathetic nervous system activation, stabilizes heart rate, and reduces cardiovascular strain. Ultimately, these interventions improve quality of life and slow disease progression. Social, cultural, and gender factors play a significant role in the experience of COPD. Gender differences, such as men experiencing less severe dyspnea and decreased symptoms perception, can influence how patients engage with their healthcare. Additionally, cultural influences can affect how symptoms are reported and treated. For example, in some cultures, stoicism may lead men to underreport symptoms. In Asian populations, traditional medicine practices and family dynamics can also impact healthcare-seeking behaviors. Recognizing these factors is essential in developing a culturally sensitive care plan that addresses each patient's needs. This is a picture of my diagram of all of my nursing interventions and how they relate with all of the human responses. This is the end of my presentation. I hope you've enjoyed it, and the next slides are my references. Thank you.